Hi everyone, this is Alex Theodoro, and you're listening to the Startup Sit Down.
Hey everyone, Alex here. I am very excited to be joined by an amazing guest today, a Techstars founder and an incredible entrepreneur and an all-around awesome guy, Brendan Sullivan from Zama Health. Thanks for coming in, Brendan.
Hey, Alex, great to be here. Thanks for having me on.
Awesome. Well, we are really excited to learn a bit more about Zama, all the way from where the heck the name came from, all the way through to what it is, what you're doing, and where it's going. So, why don't we kick things off and tell us a little bit about yourself and your story coming into the product?
Yeah, sure. So at Zama, we're really trying to develop a mental health platform for the athletic community. So this really stemmed from, my experiences. So I was captain of the track team at Yale, and even at a well-funded, well-endowed program, there's just a massive lack of resources available, and just kind of witness amongst teammates, both on my team as well as others. Just a lot of them kind of suffered through things and didn't have any sort of outlet. And so what we're essentially doing is partnering with gyms and collegiate programs to allow them to integrate clinical services into workout programs in order to improve the health and performance of their members.
Incredible. That's amazing. And like, how long would you say leading up to this, would you feel that this idea was brewing? Was it a long time coming? Was it a something that was long overdue? When did you feel this was something that you needed to jump into and take action?
Yeah, I mean, I obviously first realized that it was an issue just when I was in college, and then more so even after. I had a teammate that ended up dying by suicide, and I also just kind of, I think I always had the intention of wanting to try to do something within that healthcare, mental health, fitness space. Initially coming out of college, I worked in finance, and then I worked at a couple other startups, but a lot of it was trying to figure out how I could kind of like start my own company that really focused on these kind of issues. So about a year and a half ago, when I was still working at my other startup, I kind of started getting things together to do this. My co-founder is actually also my mother, because everyone wants to start a company with their mom. So my mom was the former associate medical director for the only inpatient eating disorder unit, general psych unit in New England. And if you know anything about athletics, eating disorders is a massive issue that a lot of athletes face. And so things kind of just worked out in terms of timing. My parents moved down back from Massachusetts, and I was kind of ready to start kind of going out on my own. So I started getting kind of the business model and the plan together. I can deep dive into that too, but started more of a B2B2C model where we are partnering already with these different institutions. And so now we have about 200 patients, about 15 clinicians. And up about a few months ago, we started kind of moving towards more focusing on the athlete community, and actually working with gyms like Equinox, and working with their members and staff.
That's incredible. That's incredible. No, and I think it's amazing, and I think it's really cool that you can be working with with your mom on this project. And I feel like if I try to tell my mom my business, I don't know if she could speak to it, let alone work on it. So I think that's really impressive that you guys can kind of join forces together. And yeah, I think that's amazing. And do you find that kind of dynamic has been helpful in the process? Do you think, like, if you were to go back in time and change anything, would there be anything that you would want to do differently in getting started on this?
Yeah, I mean, it's funny you mentioned that. My mom would be the first one to tell you that she does not work well with technology. Similar to how I am by no means a clinician, she is by no means kind of on the business or finance side. So I kind of handle all of the business development and operations and financial partnership aspects, and she kind of heads up stuff on the clinical side. So I think like having very clear roles in that way is definitely helpful. Um, I think like looking back, anything I necessarily would have been different. I don't think so necessarily. There's anything glaring. I mean, as you know, there's always like random little things that come up with a startup where you have to kind of pivot. The only thing I could think of is like really trying to focus on athletes right off out of the gate. But I think by not doing that, it's allowed us to kind of learn and frame a better offering for these places where if we had just done it right out of the gate, then I don't know if it would be as effective as we're doing it now.
Yeah, no, that's incredible. And the name, where does this name come from? It's a very unique name. I've never, I don't
Yeah,
know too many companies that start with the letter Z. So
yeah,
maybe shine a bit of a spotlight on what's the origin? Tell us a bit about the backstory of the
yeah,
name.
yeah, sure. So yeah, it's a few things. One is, when you think about mental health and how it's talked about, one of the issues is that it's very targeted towards women. The color scheme is how it's spoken about.
Interesting.
It's very much like, love yourself and love the world.
Right.
And even the names, whether it be like, not to put down like Talkspace or BetterHelp, they're fantastic companies. They're doing way better than I am, obviously. But we wanted something that wasn't so like, it didn't sound so clinical. It didn't sound so even therapy, like direct
Mm,
as a lot of these do. And something that really resonates with guys too. So that, men are 4 times more likely than women to commit suicide. And part of that unaddressed need is there's no company that they feel like really is approachable to them. And so
yeah.
our whole thing of really integrating into workouts and fitness and making more performance based and actionable, we hope that we can kind of cater to all genders, doesn't necessarily just kind of women. So the name actually means to exist. It translates to exist in Hausa. I wanted something that was unique. I wanted something that actually is relatable, but general enough that could pertain so it wasn't kind of exclusive to a certain demographic or individual or something. And to me, at
Right.
the end of the day, like what we're trying to do is help you develop your best self, to really kind of live out the existence that
Yeah.
is great for you. And so I felt like this name allowed us to do that. I also
Let's
was
hear
just
some
like,
of the.
a lot of successful companies are 4 letters, Uber, Lyft.
Yeah. Yeah.
So I was
Yeah.
like,
Yeah.
maybe I'll jump onto that too. So that was
Exactly. Exactly. Now, what were the runner-ups before Zama?
It's a thing. There wasn't like I didn't get a list of like 10 names and was like, okay, not this one and like beta test this one. It was more of just like it was more of a process of I wanted something that like I felt, you know, gave us flexibility as we change, but also relatability. And that was kind of the first one. And I was like to a few people, what do you think about this? And they're like, that sounds good. And I was like, all right. And part of it too is like from a design standpoint, is there maybe some fun things? So like we have like a kind of like I love like Nike has always been a company I really have admired, at least from a marketing standpoint. They have that swoosh. And so we kind of have this slash thing that is incorporated into our logo. So I was trying to like mimic some stuff there. So there wasn't. I'm trying to think if there's any other names. I can't really actually think of any. Like, oh, it was like one or the other.
It's okay. Yeah, no problem. I was just curious because I feel like, at least in my own experience, the name had evolved at least 4 or 5 times until I finally landed on something, only to find that that one thing had the website taken that I wanted. Totally unrelated, but yeah,
That was
that's another conversation though.
that was actually also like I think what I was trying to be almost overly practical about it too. I was like, well, what if someone put this in like SEO purposes? There's not a ton of other things that would pop
Mm,
up. But to your point too, I was like, if you want to like get a trademark on it and have like the web URL, choosing like a more of a generic name, it just makes it harder to get that kind of stuff. So
yeah,
that definitely came into play with my thought process too. I just can't
amazing.
remember what other names I was Googling before that.
No, no worries. But that's really cool though, and I love hearing kind of the evolution of things. And I think this brings me to the next question, which is what has the evolution of the product you've seen in the product, and how is that mapping onto the experiences of your customers? Like, is there
Yeah,
anything that you've been able to initially provide that you're like, we've seen some new interest, we've refined our vision, we refined our story. Is there anything there that you felt has equally undergone an evolution at Zama, and what was the impact of that?
absolutely. I think it's less like the evolution of the product and it's more of the evolution of kind of the target user and customer. So when we initially started, I mean, we have like a scheduler on our website and a couple admins in the background, but there's not a real tech wrapper around it. It was more of like knowing the market and providing a service that we know people needed, especially kind of young adults and collegiate, students. But then from doing, focus groups and surveys and better understanding the folks that we were working with, we realized we can make a bigger impact by not only providing, the therapy, but also medication management, also dietitian counseling, and then somehow integrating this, not only integrating those into workouts, but also providing services around it. So support groups that focus on kind of the needs of our audience, and actually an educational framework for the trainers, either in a gym setting or in a collegiate setting, who are usually the first line of defense of seeing issues present amongst members. So I'm also a certified personal trainer, and 90% of a trainer's job is emotional, of people coming to you with different issues that, they're oftentimes not really qualified or even comfortable answering. And so we were trying to really create more of an ecosystem around the whole person, outside of just sort of one-to-one appointments. And then for the actual practitioners that we bring on, giving them more of a continuing education on what are the actual needs of fitness goers, what are the actual needs of student athletes, because not to say that they're more important or harder necessarily than the general public, but they're different. And so how do you create a product that really focuses on their needs? Because even just taking a step back and thinking mental health broadly, essentially they're all targeted towards the general public, or they're all targeted towards employees is the bigger thing, like efficiency and burnout. And so for us, we really wanted to be ultra specific on, we are serving the athletic community, whether you're a collegiate athlete or you're just, a gym member, or and eventually expanding into youth sports and sub-professional athletes is something that, we'd like to do too.
Now, if I recall correctly, you also were, you ran, right? You ran track, you said?
Yep.
Right. So, you ran track, you were doing these, you were athletic in this respect. So in your own experience, how important was your overall health and wellness to your ability to perform?
Yeah. No, I mean, I think it's everything. I think it's also, you look back and think about times when you not are doing well, and it's very rarely due to like your physical abilities. I mean, I did have injuries, especially early on, where obviously that has an impact, but a lot of the times, most athletes will tell you like 99% of what you do is mental. And it's not even necessarily performance anxiety, which that does come into play, but it's also like all the other things in your life that are like you have to think about, whether it be finals or whether it be relationships or whether it be job and financial stuff. And I think oftentimes, especially in a professional sense, which I was not, people look at these athletes as, invincible and not human in a lot of ways, but you forget that they have all these other competing kind of factors at play, and it's crazy to think that this couldn't be impacting your ability to perform at your higher standard. So I think a lot of what we're trying to do too isn't necessarily just like being like a mental performance specialist. It's more of like, what are the underlying psychological issues that student athletes face, and how do you address those in a productive way so that they can be more effective, on the field. And so
Yeah.
part of what we're planning to do too is actually a research study on kind of this type of intervention, and looking at the performance benefits of that in addition to the health benefits.
Amazing. That's incredible. And so with that, can you tell us a bit about what is the current goals that you guys are working on? Is there anything exciting that you can let us and the listeners into, into the world of Zama, and let us know a bit about what does the current goals, or like what are the current focus areas you guys are really diving into right now, and what are you trying to accomplish with those?
Yeah, I mean, so basically going into demo day in a month, our goal is really just to, I think we're starting to get some solid traction. We just got our first two B2B deals that
Amazing.
so yeah, so we'll publicly kind of announce like who those are, but essentially one is a a gym chain in Northern California that has like 30,000 members, multiple locations. And essentially now people can sign up. When they sign up for a membership, they get access to therapy services. And for their personal training clients, they can be integrated into workout programs with the intention of it helping you better achieve your fitness goals. Also got another gym here in down here in Texas. And then we're talking to a bunch of college programs. So in terms of goals, it would either be getting a team or a program. But I think now we're kind of in a good place to start raising a pre-seed round. So kind of my goals over the next couple months is kind of getting those materials together, talking to prospective investors. I know I already have a couple that have already said they'd invest. So now it's more of just kind of building out the investment team that we think really can help us and that wants to work with us, and going from there and basically testing out this hypothesis in a real world setting, and hopefully expanding beyond that. And then simultaneously also starting to get together what a research study would look like based on our clinical model, because at the end of the day, we really want to be able to show sort of the performance benefits of doing something like this. And a lot of that is getting buy-in from athletic departments and getting buy-in from the coaches. And if you can show the performance angle, they'd be much more willing to want to, leverage something like this. So that's kind of the goal. It's kind of finalize sort of those BD contracts, raise a pre-seed round, and start getting everything together for this research study.
Awesome. Well, I'm sure that'll really resonate loudly with any investors listening in on the call. So yeah, no, that's really cool to hear. And is there any specific athletes that you find your program is best suited for?
Yeah. So I mean, the NCAA. So I actually spoke with the woman who kind of runs research at the NCAA, and they actually conducted the biggest study on collegiate athlete mental health. More a survey versus study. And I think what they found is that a lot of like individual sports tend to struggle. All sports struggle, but I think being a part of more of an individual sport with track, a lot of times you are very much in your own head, and so you can kind of see how that can make an impact. But I would say I think generally it's a lot of athletes across the board can struggle. So I think there isn't necessarily a really specific profile. I think there's certain issues that a lot of athletes have issues with, whether that be like eating disorders, self-efficacy problems, body image issues, post like life after sports, or even coming back from injury and fear avoidance. So I would say these are issues that permeate athletics, no matter what sport you're coming from. And so I think like that's kind of how we're approaching it.
Yeah, no, that's amazing. I think there's like, the research brain in me is definitely thinking a lot here. You got the gears turning, so to speak, right? And I'm curious about, the receptivity of these programs based on the type of athlete you're working with, right? And you mentioned a very interesting point. Solo athletes that, independent, that are working independently towards their goals, like you said, track versus a team sport, with like football or soccer. And you almost wonder if the power of the group helps or hurts that journey. Do you have any comments on that? Is there anything that you've observed in research, or maybe in your own findings, how
Yeah.
group versus independent athletes
Yeah, I mean,
function?
there's a bunch of research out there of like how, being part of a group improves your likelihood of hitting fitness goals generally. Like gyms, I don't know the exact stat here, but gyms that offer, group classes have way better retention rates than those that don't. And I think like having a buddy, so to speak, is definitely helpful in that sense. I would also say the way our model works is, whatever the main psychological issue that we identify of like contributing to, your inability to hit your fitness goal, you kind of get a 4-step action plan every month. And one of those steps has a social component. So there's a lot of research out there that the social aspect is very helpful. And so, way we think it is more of like a support group type thing. But, peer-to-peer support is massive. And I think the next evolution of this platform is not just being able to access these services, but being able to anonymously connect with other individuals that, match your sort of background and issue area that you're working towards. Because a lot of times you don't necessarily want to talk to a family member or even a therapist. You really just want to speak with someone going through what you're going through. And so being able to reach out anonymously, but still kind of see what they found helpful is really powerful and really useful. And also makes it easier to kind of scale the services that we can offer, because it's not like you just need a clinician every time you are looking for support.
Absolutely. And you mentioned something there. You mentioned about the next steps or looking forward, and I'd love to hear a bit about what does the future of Zama look like to you?
Yeah, I mean, we really want to own the whole athlete uh, continuum in terms of youth sports and through high school and college and postgraduate. And now you're going to gyms and just kind of working out in sub-professional. So, no matter what level, there's certain issues that impact an athlete's journey. And so we really want to kind of help that individual through the whole kind of time frame of that. So my goal would be, although we're starting more on this collegiate and gym focus, like really expanding in terms of serving all ages and demographics with that. And then in terms of kind of what I said is really establishing this peer-to-peer community aspect.
Mhm.
So I don't know if you're familiar with the Mighty. It's like one of the largest I think it is the largest social network for individuals with chronic issues. And they have millions of users, and it's all just people just posting questions about chronic issue they have, and how other people who have similar issues, what they're doing. And so they've shown that people really do want this sense of community from other people who are experiencing same challenges. And in a similar vein, we want to establish that amongst the athlete community, because, for instance, when you graduate college, you've had your entire life structured up until then, from an eating standpoint, from a physical standpoint. I had several friends that lost a ton of weight or gained a ton of weight post graduation because they didn't really know how to regulate that on their own. And so actually being able to reach out and connect with someone maybe a few years older that just went through it, it's usually actually way more helpful than even speaking to a dietitian, because very few dietitians know what it's like to be a D1 football player. And
Right.
so while we want to have at our core this clinical aspect, we believe that peer-to-peer support is kind of crucial to our long-term success.
100%. And I think you mentioned it beautifully, right? Is that you want someone that's been there, done that, and has walked through those shoes, in some capacity versus someone as like an outsider looking in. And I think there's a lot of beauty and elegance in being able to provide that at a more human level. So no, that's incredible, and I think it's a testament to the work that you've done and the impact that you guys are going to have in the athletic community and beyond. So maybe I'd love for you to share a little bit about where people can get in touch with you. How can they find out more?
Yeah, absolutely. So our website is zamahealth.com. So they can find out more information there. We are planning to, we're really planning to go through our B2B partners to really push this out to folks. So hopefully the goal would be any gym or kind of fitness company that you work with near you will eventually integrate our services. So, if you want to find out more, zamahealth.com, and ideally, they'll be finding out about us through some of these channel partners that we're starting to establish too.
Alrighty. Well, looking forward to hearing more. And thanks again, Brendan, for coming in. And it was a pleasure to speak with you and share your story with everyone.
Awesome. That sounds great, Alex. Always a pleasure to hop on, and excited to have you down here with me as well.
Awesome. Take care.
All right. Bye.